Well, hi, and thank you for being here today as we talk about something that really resonates with us all as Rotarians and as global citizens. So I'm going to start my PowerPoint here in just a second. Perfect. Okay. So with World Polio Day approaching on October 24th, of course, it's important to remind ourselves that the fight to eradicate polio is ongoing. Polio remains a critical threat, especially in the most vulnerable communities, such as those in conflict zones. So today I would like to talk to you about three key areas. The significance of eradicating polio and why now is crucial, the intersection of polio and conflict, particularly in places like Gaza, and of course, Rotary's role in the fight against polio and how it aligns with our 7 areas of focus. So let's start by remembering what's at stake in our battle against polio. Polio, a disease that paralyzed and killed thousands in the 20th century, became a major global epidemic. In the 1950s, tens of thousands of children in North America alone were affected annually. Of course, the introduction of the Salk vaccine significantly reduced these cases. Rotary has played a role in the global eradication efforts of polio since 1988 through the Global Polio Eradication Initiative. Over 2.5 billion children have been vaccinated, reducing cases by 99%. However, wild polio virus remains endemic in 2 countries, Afghanistan and Pakistan. So despite our successes, the battle is far from over and vulnerable regions remain at risk. So the current challenge, while many countries are polio-free, there are still regions where the virus lurks, waiting for an opportunity to strike. Conflict zones are especially at risk as they create that perfect storm for disease outbreaks. Disrupted healthcare systems, poor sanitation, and displaced populations all contribute to the spread of infectious diseases. Gaza is a clear example of this risk. Earlier this year, Gaza recorded its first polio case in over 25 years. This occurred in a region already grappling with war, poverty, and limited access to healthcare. The fragile infrastructure in Gaza has been further decimated by recent bombings, leaving over 2.3 million people vulnerable to waterborne diseases like polio. So it's in places like this that we need to focus our efforts. For as long as polio exists anywhere, it remains a threat everywhere. So the current challenge, of course. In September, during a brief ceasefire, over 340,000 children under the age of 10 were vaccinated in Gaza, a tremendous achievement in such a volatile environment where an estimated 95% of eligible children were reached, which is great news. The vaccination focused on delivering the oral polio vaccine, which is especially designed to address both wild polio virus and vaccine-derived polio virus. So this campaign is essential in preventing a full-scale outbreak. The next round is set to provide the second dose of the oral polio vaccine and should begin any time now. I believe October 14th was the scheduled date. At least 2 doses of the vaccine are necessary to stop transmission of the virus, and at least 90% of children need to be vaccinated to prevent it from spreading. The campaign relies on an intricate network of local health workers, many of whom risk their own safety to ensure vaccines reach every child. Of course, this includes navigating destroyed infrastructure, power shortages, and blockades that limit access to medical supplies. Yet it is in the face of these challenges that we see the true spirit of Rotary's mission, working tirelessly to serve humanity, even in the most difficult circumstances. The success of this campaign depends not just on logistics, but on global solidarity. Rotary's financial and organizational support will be crucial in ensuring these vaccines reach those who need them most. So imagine being a parent in Gaza, where you not only worry about bombings, but also about whether your child will become paralyzed by drinking contaminated water. The conditions in war-torn regions exacerbate the spread of polio, with sewage-contained water serving as a breeding ground for the virus. With healthcare systems already weakened and access to clean water severely limited, the threat of polio outbreak is imminent, and if we don't act quickly and decisively. Gaza is not alone in facing this challenge, of course. Throughout history, polio has flourished in times of crisis. The ongoing conflicts in Afghanistan and Pakistan continue to complicate eradication efforts in those countries, where healthcare workers are often targeted and misinformation about vaccines remains rampant. Rotary has long been committed to the fight against polio. Through the Polio Plus initiative, Rotary has contributed over $2.6 billion to polio eradication efforts and has provided vaccines to billions of children. But it's not just about the numbers. It's about the partnerships we've built with organizations like WHO, UNICEF, and of course the Bill Gates Foundation and local governments, all working toward a common goal. So Rotary's role goes beyond financial support. It includes advocating for the protection of healthcare workers and ensuring that vaccines reach even the most remote and dangerous areas. So the synergy between our fight against polio and Rotary's 7 areas of focus shows how these areas are all connected to our mission, highlighting how tackling polio ties into making a difference in global health and well-being. Peace building and conflict prevention. Of course, ceasefires in conflict zones allow us to vaccinate children. In war-torn regions, Rotary's advocacy for peace and cooperation is essential for the success of vaccination campaigns. Disease prevention and treatment. At its core, our fight against polio is about preventing disease and treating its effects. Vaccines are a simple, cost-effective solution that saves lives and prevents paralysis. Our third area of focus, water, sanitation, and hygiene. Polio spreads in unsanitary conditions. So by supporting Rotary's WASH initiatives, we create healthier environments that prevent the spread of diseases like polio. Maternal and child health. Polio affects children disproportionately, making vaccination campaigns critical to improving child health in vulnerable regions. Area number 5, basic education and literacy. Of course, education combats misinformation. Rotary's literacy projects and programs play a role in ensuring that communities understand the importance of vaccination and trust the science behind it. Our 6th area of focus, community economic development. Of course, healthy children become productive adults. Polio eradication reduces the economic burden of families and strengthens communities by enabling all children to live healthy, fulfilling lives. And finally, supporting the environment. The logistics of vaccine distribution often involves navigating difficult climates and remote regions. So Rotary support for environmental sustainability ensures that vaccines reach the most vulnerable populations, regardless of geography. There should be one more slide here. So as Rotarians, we know that the work we do extends far beyond our immediate communities. We are part of a global network, and our efforts, big or small, contribute to monumental achievements. The eradication of polio is not just Rotary's responsibility, it's the world's responsibility. But we as Rotarians have been given the honor of leading this charge. Imagine the day when we announce that polio is no longer a threat. Imagine the relief of parents in Gaza, Afghanistan, and Pakistan, knowing that their children will never be paralyzed by this disease. This is within our reach, but it will take all of us, mobilized, united, and determined to see it through. We cannot afford to let it up, especially now when we are so close. So, we need to keep the fight alive. We need to remember that we are at a pivotal moment, and while the end of polio is in sight, it's a fragile victory that could slip away if we don't stay vigilant. As Rotarians, we have the power to make polio eradication one of the greatest humanitarian triumphs of our time. Today, we have the opportunity to do our own Little Purple Pinky campaign. If you don't know the significance of the Purple Pinky, I'll just give you a little brief history of that. So on immunization campaign days, each child who receives their 2 drops of vaccine has their pinky painted purple to indicate that they have received their dose. I can tell you from our experience in India that when Westerners are providing these vaccinations, the young children like to keep coming back to meet with us and chat. And so if we're not careful about this, sometimes the kids will get more than one dose of their vaccination. Of course, that's not the main reason we do it. We do it because we want to make sure that every child in a community does get their purple pinky to say that they've all been fully vaccinated. You can donate to End Polio, of course, directly by visiting the website that you see here on your screen, endpolionow.org. Or I'm sure your club would be happy to collect funds on your behalf and donate that to End Polio and the Rotary Foundation. The cost to immunize each child is about $4 Canadian. That's half price for you in the US, more or less. So how many children's lives will you save today? Remember that the Bill Gates Foundation will be matching that donation 2-to-1, so that's win-win. And if you'd like to learn more about the powerful role Rotary has played in the eradication of polio, there's a website specifically focused on this. Same address is where you can make your donation to End Polio, endpolionow.org. Thank you for your ongoing dedication to this cause. Together, we're going to achieve a world free from polio. We're this close. Let's finish the fight. Thanks so much. Have a great day, and polio now.